going to just gather my equipment here. I have my stethoscope, my pen light, and our equipment to check the tendon reflexes. Can you verify your name and date of birth for me, please?
Evelia Cabrera, November 14th, 1992.
Okay, perfect. Let me just wash my hands. So I would wash my hands. All right. Can you just tell me today's date?
November 30th.
Yes, November 30th of
Yes.
what year?
2022.
Okay, and then can you tell me where you're at right now?
I'm at the Wilshire Hospital.
Good. And then who is our president?
Joe Biden.
Perfect. All right, I'm just gonna go ahead and start by listening to your lungs. So I notice she's alert and she's oriented ×3. I'm actually gonna have you turn to the side
Okay.
just a little bit so she can see the placement. Yep. Take a deep breath for me. Again. Deep breath. Deep breath. I got 2 more at the bases. Deep breath. And we're gonna assess the right mid-lobe. If you can raise your arm, take a deep breath for me. Perfect. Okay, you can have a seat again. And I'm gonna listen to the front, auscultate the lung sounds. Take a deep breath again for me. Good. Another deep breath. And then 2 more. 1 more. Very good. Just breathe normal. I'm going to go ahead and listen to the carotid arteries with the bell. Okay. And it's 2+ no thrill or bruit heard. All right, dear. I'm just going to go ahead and check your strength. If you can just squeeze my fingers. Now I need you to press up against my hands and down. Good. Checking for skin turgor. At the same time, the patient would be laying down. I'd be checking her skin for any lesions or scars. Checking the radial pulses. I've assessed the skin turgor. Now I'm going to look at the capillary refill. Very good. Now I'm going to shine a bright light in your eye, okay? If you look straight at my nose. Sorry, it's bright. Checking for perla. Making sure they're round and equal. Size 3. Very good. If you just follow the movement, I'm in pen with only your eyes without moving your head. Checking for extraocular movement. Which is good. And then look straight at it for me. Assessing accommodation, which is good. Very good. Can you go ahead, and I'm going to go ahead and assess the cranial nerves. And raise and lower your eyebrows for me. Very good. And can you close your eyes and tell me which side of the sound that you hear? Which side of your ear?
Left side. Right side.
Very good. Keep them closed and tell me if you can feel that. I
Yes.
would use a cotton ball if I had one. Can you feel that?
Yes.
Very good. Okay, you can open your eyes and smile for me. Puff your cheeks. And I've already checked for sensation. Okay, if you don't mind opening your mouth, and I would assess for rhizal uvula. I could have the patient saying ah with a tongue depressor. And then if you don't mind sticking your tongue out for me, going to the right, then going to the left. Check for tongue movement. Very good. And then if you can shrug your shoulders for me. Very good. All right. I'm going to have you stand. We're going to check your flexion and your upper extremities. So if you don't mind bringing your arms, face them forward, you're going to bring them towards you into flexion. Bring them back down into extension. All right, and then I'm going to have you also flex your right leg. So you're going to bring like a kickback and then extend towards the front. And the other side as well, please. Perfect. And extend out. And then we're going to check your back as well. If you can flex towards the front and then raise back up into extension. And then if you don't mind rotating to this side. Perfect. Okay, you can have a seat for me. Now I would have the patient lie back and finish the abdominal assessment. Just listen to her lungs, her bowel sounds. Auscultate before I palpate. I'm inspecting at the same time. Tell me if you feel any pain or tenderness with light palpation. At the same time, I'll be assessing the lower abdomen for any bladder distension, which none is noted. And if you lean forward just a little bit, I'm gonna check the back side I'll have you turn for her so she can see. And check in the right and left flank areas. There'll be some pressure you may feel, but there should not be any pain. Let me know if you feel any pain, okay? So assessing the left, now the right.
No
All right, no pain? Very good. Have a seat for me. All right, now I'm gonna go ahead, I did the top radial. Now I'm gonna go ahead and assess the bottom. So posterior tibial for the pulse. We'll do both sides. And now we're gonna go with the pedal. Very good. At the same time, I would be assessing for any edema. None were noted. I'm gonna go ahead and check the tendon reflexes. We'll do the brachial. Should I go this way? All right. And then we will do the other brachial side. Very good. And now we're gonna check the patellar tendon reflex. And the left side. Very good. Okay, now I'm gonna have you stand one more time. And we're gonna check for coordination. So if you don't mind holding your arms at the sides. And then go ahead and extend out and bring one arm to the nose. So you can bring your right arm to your nose. And then extend back. Now your left arm. We're checking for coordination. Very good. Now we're gonna have you stand with your feet together and with your arms at the side. And we're gonna start with your eyes open for about 30 seconds, and I'm observing for any kind of swaying or balance issues, and stay kind of close by in case any safety issues arise. And then if we'll do that again with your eyes closed, also checking for balance. Notice for any swaying, none were noted after 30 seconds. And then one more time, I'll have you face forward. You can open your eyes, and we're gonna do a heel to toe walk. And you're gonna bring one across the other, yep. And just take a couple steps forward, very good. And then you can come back. Very good. Okay. If you wanna have a seat for me. I think that is it. I did cap refill. Okay, so now I'm just gonna go ahead and make sure the patient is comfortable. Give them the call light that they can use. We'll be back in another hour. And are you comfortable? Do you have any pain?
Yes. No pain.
Okay, I will wash my hands.